Thank you for joining us for the 4th Annual Global Summit on Kidney Innovations, Global Kidney Patient Voice, the Key to Accelerating Innovation, a collaborative partnership between the American Association of Kidney Patients and the George Washington School of Medicine and Health Sciences. My name is Kevin Fowler, and I'm a former board member for the American Association of Kidney Patients, and I continue to serve as a AAKP Ambassador for the state of Missouri. I'm also someone living with kidney disease, having received a preemptive kidney transplant in 2004. And based upon my experience of living with the consequences of polycystic kidney disease and facing the reality of kidney failure, my goal was to avoid dialysis by receiving a preemptive transplant. And my hope for all individuals suffering from kidney disease and facing kidney transplant is for them never need to go on dialysis and to receive a preemptive transplant, so that a preemptive transplant becomes more the norm rather than the exception as it is right now. And as a fellow patient advocate, or as a fellow patient, I have a deep passion for patient advocacy and patient engagement in the production and device lifecycle of novel treatments that answer the need and preferences of patients and their families. And those that are going through the journey of kidney disease firsthand, who really know what it's all about. This passion has led me into a career spanning over 30 years in both commercial and research and development roles for commercial enterprises. In addition to my role with the AAKP, I'm also the patient editor for the Clinical Journal of the American Society of Nephrology, CJSN. I'm also on the board of directors of the Kidney Health Initiative, which is a public-private partnership between the American Society of Nephrology and the US FDA. KHI has a mission to catalyze innovation and development of safe and effective patient-centered therapies for people living with kidney diseases. And for today's session on Global Kidney Patient Voice, the key to accelerating innovation, industry efforts across the globe advancing kidney patient care, I had the pleasure of conducting a series of interviews with national and global companies in the kidney space that are leading the effort to disrupt the status quo by making an investment in new treatments to address the many unmet needs of people living with kidney diseases, while also working tirelessly to integrate the patients and their unique insights along the way. In full disclosure, based upon my professional background working with life science companies, I have consulted for some of the organizations that I have interviewed. I enjoyed speaking with all these industry representatives across the globe and ask you to join me in watching excerpts of these interviews. Full interviews will be available post-Global Summit on demand on AAKP's social media platforms and YouTube channel. Thank you, and I hope you're just as inspired listening to these discussions as I was conducting them.
Our focus as a community of kidney care stakeholders has definitely evolved along with all of healthcare in a direction of greater patient centricity, putting the patient first. How that translates to the world of drug development, clinical trials, is through making a more deliberate effort to ensure that we integrate the patient voice within our drug development plans. For example, when we have a comorbid condition relating to patients with kidney disease, say anemia, where in spite of the availability of injectable treatment for the past 30 years, there remains significant unmet need among the patient community. Patients, nephrologists need support in identifying anemia and then for shared decision-making in its management. The current unmet need is characterized by unacceptably high levels of blood transfusion, which carries its own drawbacks. We're also very aware of the move toward greater numbers of patients dialyzing at home and ways that we can support that process, how we can help make home dialysis more convenient, a smoother part of their lives. This could contribute to the United States catching up to other countries around the world that have greater percentage of home dialysis. There's so much that we need to better understand as drug developers who are intent on bringing innovative medicines to people with kidney disease. We need to better understand about the impact of related health conditions. What meaningful impact on patients' lives look like? How to measure that impact? How to compare interventions, all for the important purpose of being able to demonstrate effectiveness and value for the treatments that we bring to the community. In the United States, the FDA, to its credit, has supported and led a series of patient-focused drug development meetings, but the many additionally led external meetings on patient-focused drug development speak to the need for stronger inclusion of the patient voice within drug development, especially for the voices of patients with kidney diseases. There's more to be done to hear from patients who suffer from the most common comorbid conditions associated with chronic kidney disease, and to identify opportunities to impact their lives for the better, much as we've already done in patients with rare disorders of the kidney. Akebia Therapeutics is a fully integrated biopharmaceutical company formed in 2007, and we have as our purpose bettering the lives of people impacted by kidney disease. Our treatments, both currently marketed as well as in development, focus on hyperphosphatemia and anemia of chronic kidney disease. We're leaders in the discovery and development of HIF biology. Those are medicines acting on the hypoxia-inducible factor prolyl hydroxylase as inhibitors designed to mimic the physiologic effect of altitude on oxygen availability. We have been very proud of our ongoing research in applying this HIF science to anemia of chronic kidney disease, as well as additional critical care applications, such as treatment of ARDS, adult respiratory distress syndrome. There are always ups and downs in drug discovery and development, but we are very excited about the science and proud of our work over the past 15 years, helping to bring innovative medicines to patients with kidney disease.
I'd like to thank again the vast number of industry partners that took the time to sit down and have a discussion with me. Through AAKP Global, launched in 2019, AAKP is engaged globally because we are committed to educating patients, leaders, and companies across the globe on the importance of kidney disease prevention, new innovations in treatment, and the opportunity to save more lives. We believe that united patient voice can drive innovation and the policy decisions that determine timely regulation and payment for new and safe treatments. Globally, AAKP is working with patients, medical professionals, researchers, and medical industry allies, such as those you just heard from, to cultivate a united consortium led by patients. AAKP believes that this global consortium can advance innovation and change kidney care in countries where health systems or infrastructures do not support patient-consumer choice or access to care treatments. Again, thank you to each of our industry partners for sharing with us the innovations their companies are working on or has available to improve kidney care from prevention and diagnosis to transplantation or access to care treatments.